Welcome to Adult NCLEX. Newborn nursing is very important. And these birth to 12 month are the areas they will ask you questions. Let me ask you a question. What age should a baby be cooing? When does babbling start? If you cannot answer this question confidently, then this video is for you. Let's go over every language and social milestones that you need for 0 to 12 months, whether you're taking the NCLEX or you're in nursing school. I'm going to give you a simple mnemonic. At the end, I'll give you NCLEX steps. You should watch the video to the end. You see NCLEX steps, and we have 1 or 2 questions to analyze that. But let's get to it as usual. So the first thing we're going to do is this question. Look at it carefully, and we'll come back to it. A nurse is assessing a 2-month-old infant during a well baby visit. Which of the following findings should the nurse expect? Specific use of mama or dada, stranger anxiety, cooing and social smile, babbling with the consonant sound. Once again, keyword is the buzzword, is a 2-month-old. What do you expect a 2-month-old to do? This baby is young. And so when you use a common sense way to answer these questions, anything that is so advanced, you avoid it. But we'll come back to it. Think about it as we go through the lecture as usual. What is the simple mnemonic to get to know all these language problem associated with the baby in terms of social interaction? It's what? Smile, coo, laugh, babble, and mama. That's all. You don't need to memorize anything. This is the progression that you need. They're going to smile, and then they'll coo, then they laugh, they babble, and they make a sound by saying mama. Therefore, what do you think? Social smile is the first one. It overlaps with cooing. So by 6 weeks, they start happening. By 2 months, you should have a social smile. By 2 months, 8 weeks, the baby should have a social smile. But some, it starts right away by 6 weeks. And what is that? Usually, the baby smile in response to what? A caregiver voice. If their face, when they see their face, they smile. When they hear their voice, they smile. Whatever they do, they see their caregiver, they will show some sign of knowing who they're dealing with. So they provide social smile for interaction. What did they think the NCLEX will ask you or nursing school will ask you? If this social smile is not present by 3 months, that is a big problem. 2 months is the latest. If it doesn't happen by 3 months, you got to evaluate for vision problem or attachment or neurological problem. There's something not right that the baby is not providing this information to the parents by smiling to them and telling them they recognize it, right? That they hear their voice and you know who they are. The next group is what? Cooing. So they and the social smile or care, they overlap. So 2 months, you should be smiling and cooing. That's the mnemonic. Cooing, smiling, the laugh and babble and mama. Okay. So that one also happened by 6 to 8 weeks. By 2 months, you should have it. And what is the problem? They use vowels. Easy way. Before you can use consonants, you need to know how to use vowel. So vowel-like sound. O, ah, showing vocal cord use and social intent. They want to make sound, but you can't make a sound by not knowing how to utilize your vowel. So that's what they do. Absence of this is a sign of hearing loss, always a neurological problem. Voice are mostly hearing issue and neurological, they cannot make sense out of it. Next group is what? Laughing. If you smile, you're cool, and you're making you start to what? Laugh. You make more. You try to use your vocal cord by 4 months. So 2 months, smile and cool, and then laughing by 4 months. And this is very, very important because it changes everything. The baby begins to giggle and laugh out loud in social interaction because they can see people smiling. So they want to interact with the environment, their mommy, anybody around. And that is very key. If you don't see that, you can see that something is wrong. And because the baby does this to show bonding, right? Associated with bonding and early emotional expression. This is very key. Laughing relieves some hormones in our system. And at this stage, the baby is trying to bond with their parent and early emotional expression. If you're laughing, well, you start now, you have more vocal words, you can figure out what is going on. 4 months to 6 months, you start to babble. The kid will babble. Now they're being able to use vowel. They go to the bigger words. They combine the vowel with the consonant. So consonants sound like ba, da, ga, because they're combining the vowel with the consonants, right? And this is how they've advanced. If it's absent by 6 to 9 months, you suspect a hearing or developmental delay. This is a red flag. They can say ba, da, and you have to worry about something is not right. They can hear what you're telling them, or neurologically, they are. What is the next one? Now they've been able to use the vowel. They have been able to laugh. They've been able to babble by combining consonant and vowel. Now they can make a word like mommy, dada, but non-specific. They cannot distinguish between them. They can say mommy is mommy, dada. You can say dada is mommy. So you say mama, dada, non-specific. Mama, dada, non-specific by 9 months. And what do you expect them to do? Sound like mama and dada images, but not yet attached to specific meaning. They don't know what it is, right? So by 9 months, this is what they're doing. These are usually non-specific at this stage. Specific name comes when they come closer to 12 months. 12 months, they can specifically know. So this is the progression. You smile, you coo, you laugh, you say babble, and you say mama. So as they give you a question about sound, you give the higher use of mental capacity to older patients, older clients, less than 12. But 9 months and 2 months, you'll be saying different things in terms of words. Smile, coo, laugh, babble, and say mama. There's some few bonuses I want you to know because they don't follow the progression, but they're specific. Name recognition, to specifically recognize your name, okay, between 6 to 7 months. And what is it? The baby will turn when you call them by their name now. You tell them, now they know, like we say, hey, but John, they will turn their head to the sound where the sound is coming from. That's 6 to 7 months. And this is very important. If the kid cannot respond, you think they may have autistic issue, right? It's a red flag. They don't respond to the specific name that is being given unto them. The next one is stranger anxiety, which is different from what? Separation anxiety. Be careful. Stranger anxiety occur by 6 months, right? And the baby will show distress around unfamiliar people. If they don't know you, they don't like it, right? And this is a normal part, right? Attachment and social interaction. If they don't know you, they try to stay away from you. It's very, very normal. It's not a major problem. Separation anxiety occurred later, 9 months. Now they worry that they cry when the caregiver leaves. It's different from stranger anxiety. When stranger people are around, they feel distress. And these peak by 10 to 18 months, right? And they start, like I said, 9 months. Not a behavioral problem. These are all expected finding in the kid of this age. So these are little things I want you to know. The last slide talks about what you have to pay attention, the progression. I give you a question, put it in the form. Is the baby smiling? Is it cooing? Is it laughing and babbling? And you know that they start by 2 months, 6 to 8 weeks. And then by 4 months, they're laughing. 6 months, they're babbling. And then they start using mommy and daddy by 9 months. The red flag, if there's no cooing by 3 months, because the latest they can do that is 2 months. If there's no babbling by 6 to 9 months, we have a problem. No smiling by 3 months, social smile by 6 to 8 weeks, it should be there. If they don't respond to their name by 9 months, you have a problem. These are specific. They're going to ask you in your test whether you're taking nursing exams or you're taking the NCLEX exams. Know them, smile, cooing, laughing, babbling, and saying mama, dada. That's 1 year old. These are very important. Let's look at two questions. Okay. A 7-month-old infant does not respond to the name. You know the problem being called. Which of the following action by the nurse is most appropriate? Stop the video, look at it, answer your question. What do you think? Document the finding as normal. Reassess language development at 12 months. Educate the parent that the name response usually begin at 9 months. Report the finding to the healthcare provider for further evaluation. What do you think? 7-month-old does not respond to them. What is the name associated with that? What is the big problem associated with it? What do you think the baby should do? This is very, very important that you have to pay attention. This is how they can trick you, right? As you know from the lecture, this is not a normal finding, right? Reassess the language development by 12 months. That's too late. Educate the parent that the name response usually begin at 9 months, no, at 7 months. You should be able to do that by the 6 to 7 months. They should be able to tend towards whoever is calling them. You should report the finding to the care provider for further evaluation. This is very, very important. And this is the way the questions will be framed. Okay. The next question. This is the first question we saw. A nurse is assessing a 2-month-old infant during a well baby visit. Which of the following findings should the nurse expect? 2-month-old. What you should expect? Specific use of mama and dada to be able to specifically use it. That is too young. Stranger, even by 9 months, they cannot specifically, there's no specific distinguishing features associated with that. Stranger anxiety, that is like close to 6 months. The baby is not ready yet. Cooing and smiling, 6 to 8 weeks is specific for them. They have these cooing and smiling. Always, whenever you see cooing, look for answer associated with smile, because social smile, they interact 6 to 8 weeks. Babbling with consonant is an advance, right? You got to coo before you can use vowel. Then when you use a vowel, then you use a consonant. So consonant is more even advanced by using vowel. So the right answer is cooing and a social smile. Now you know the languages that the kids need. You have to pay attention to the buzzword, and that is what? Smile, cooing, laugh, babble, and what? Mama. 4 to 6 to 8 weeks, 4 months, 6 months, and 9 months. Take care of yourself. Thank you. If you like this video, you want to help the channel, you can click on the like button and then comment on the video. If you have a question, just comment on it so that we can grow this channel. Take care of yourself and good luck. Bye-bye.